Well, doctors, two of the important facilities that you are going to get on medicalcareindia.com is one, after you log in and register and log in, you can search medical practice resources in your daily to daily practice, and we have been putting in all the knowledge base inside this so that even on your mobile or computer anywhere, anytime, you can look in the various knowledge base that is required for clinical practice. Like, suppose you come across any patient of coma or anything in medical system, means coma being the keyword, and the coma here it is staging of sarcoma, so Glasgow coma scale. So you want to see this, just click this and search or submit, and then you will come to this neurology. This is the subtopic, and just click on the view, and you will get the detail of Glasgow Coma Scale, what is eye opening, and what are the responses and all. So similarly, whatever is available and whatever you want to search again here. Suppose you want to know something about diarrhea, so write DIARR. So these are the topics available in this knowledge base about diarrhea. So it's post-diarrhea complications of acute infectious diarrheal illness, comparison of this, and gastrointestinal pathogens causing diarrhea. So anywhere, whatever you want to see, just click submit, and you have to click on the view here, and you will see the detail of gastrointestinal pathogens causing acute diarrhea. What is the mechanisms, what are the locations, and what is the illness, and what are the stool findings and examples of the pathogens involved. So this information will be coming to you from various textbooks of medicine and others that we have been trying for many years to incorporate into the clinical knowledge database. This will be very useful for you to search for any information available in this, and we are constantly expanding on this. Next information which is available is diagnostic system. This also we are evolving through and constantly upgrading upon this. Suppose you want to know about the diagnosis which you are not very certain in particular case. This is the mobile number. You can write it is a fixed number. You can just write what is the age of the patient. Suppose it is 78 and it is a female patient. What is the onset of the symptom, whatever you are going to write. So it is a rapid onset, and duration for some maybe weeks, and progression is average, rapid, whatever you want to write. And severity of the symptom is suppose moderate. Now what are the symptoms that the patient has? General symptom. So these are the general symptoms like weight loss. Okay. If you have any other symptom, any other of these symptoms, any other symptoms, suppose if fatigue, just press on the control button and click this so that you can now select the both. Now close this general symptom. Suppose you want to have the psychological symptom. Suppose the patient has confusion. Okay, so now all this symptom you can select from the systems which is available, and all these symptoms are here under different headings. And after selection of the symptom, you have to just press on the submit button below, submit the symptoms, and once you place submit, the possible diagnosis in that patient is these, and it is written a symptom that 78-year female presented with on this date complaints of weight loss, fatigue, confusion, rapid in onset, moderate in severity. So history has been written for by the computer, progression is rapid. So following diagnosis being considered. So these are the possible diagnoses. These are the possible diagnoses in order of the priority, you see, AIDS being the minimum, and maximum possibilities that of the hepatitis, relative probability 440. Now you can click on each of these, and know about the detail. Suppose if there is excess of alcohol intake, so history you have to ask about these particular things. If it is present, just click here and submit. If these two are not present, okay, submit. Now the diagnostic upgradation will be there. That information has become 748. It has been checked now. Similarly, you can go on clicking each of these and find specific findings or history or physical examination in that particular disease, which I think you may not be able to consider in its daily-to-daily practice. So this is very useful for you to practice. Suppose you click on here in congestive heart failure, and if there is nothing to check here, move to the next diagnosis, and whatever you have checked, it will be written here checked. So similarly, you can click on any of them and now see the investigation findings and expectations. So these are the diseases which has more than 100 numbers, so it has been categorized and trimmed to this number of possibility. Now you can click further check of the investigations required in each of these cases. Like in hepatitis, you have to do these investigations, and if this is positive, you have to click here, otherwise it's not. Move to the next diagnosis. Suppose it is positive, and move to the next diagnosis. Now your diagnosis is further enhanced to 1496. So this has been checked. Now you can see the treatment of this particular disease, or you can add this diagnosis to the patient's database, and you can add this diagnosis. Similarly, you can check all of these diseases, the investigations required, and the expectation findings in each of them, and so that you cannot miss any of the diseases, and you will know about everything that is possible in today's medicine. You can see the treatment of hepatitis, which is currently being practiced here. So all this is constantly being upgraded in our database so that a medical practitioner will have the complete knowledge at his command in each of the cases, and of course all these treatment decisions and complications of course will reduce with this endeavor. I think you will use this and to your advantage and help us in increasing the standard and acceptability of medicine in the modern society. Thank you.